Fortunately, I will tell you that in our data, programs that are not at satisfactory or higher are rarely getting any reduction. I mean, and that's only about 30% of programs. So, you got to push them hard to really get effects. It depends on the study. Usually, it depends on the study only because it's how long the grant is or the time period. Anywhere from a year to longer. In Ohio, we do 1, 2, and 3 year cohorts. So we track them a year out, 2 years out, 3 years out, and we go into the adult system with the data. That's how we do it. The most important thing about recidivism, and by the way, we do tell you should be looking at your recidivism data, but here's the thing you have to understand from a research perspective. If you said to me, my drug court has a 80% success rate, that doesn't mean anything. Hell, we might have 90 without it. In other words, without a control group, I don't know if you're having an effect. Now you can compare year to year, but hey, the kids change, the program change, right? So that's a little dicier, right? The most important thing in a recidivism study is the two things that affect rates the most are how long you follow them and how you define recidivism, right? You want a good measure of recidivism, define it as, return to an institution and only follow them for a month. You'll have a great recidivism, right? So, but that aside, the key is, do you have a risk control comparison group? All right. That's really, at the end of the day, if you wanted to find out, is your drug court effective, I've got to find kids with a drug problem that don't go to the drug court and see if they're doing better or worse than the kids that do. At the end of the day, that's how, no matter how long I follow, I'm following them at the same amount of time. So a year is acceptable for a follow-up, with some exceptions. Sex offenders, it would never be enough. Age rates are too low. Yeah.
Question about the doses of.
Yeah.
Realistically speaking, with finances, with how they're on probation and parole, the
Yeah.
other things they're getting, and bottom line action nowadays, financial system.
Yeah.
What would be a happy medium? What would be an okay amount of dosage? Because when we look at a substance abuse student that goes 4 months, they're gaining or whatever, they're going to get really 100 hours of college most parts actually need 200 hours.
Yeah.
I don't know.
You want me to compromise on it, huh? Is that what you're asking? Yeah, here's what I'd say. I think what the data's saying to us is, clearly, you can't have a one-size-fits-all program, all right? What it probably means is that, what do we know? The low-risk kids don't need much, right? I mean, you got to free up some time, okay? The moderate-risk kids, we can get by with this, with this range. It's the high-end kids that need a lot more. And so if you can't give them that much more, you're probably not going to get the effects that you want.
Let me ask you just a clarification. If you say it's 100 or 200 hours per that specific needed treatment, or would you say overall?
No, I mean overall. I mean evidence-based, structured programming. All right, let me say that first of all. If you're talking about, if people say, well, I want to count recreation, I want to count because I'm teaching them things, I want to count educational groups, I'm going to tell you that I wouldn't waste my time on it. Other thing I tell you is that, get rid of the things that don't work. So, for example, this is an example in the EPICS model where we train probation officers. Here's what we found. The time they spend in sessions with kids is way too short on the average. Right? So we knew we had to increase it. Problem is, how do you do that, right? You got a caseload, you can only see kids, so you only have so much time. Well, what it's forcing those agencies to do is to restructure how they're handling low-risk kids, how they're handling moderate risk, because the model is for high-risk kids. So if I'm going to say to you as an officer, you've got to spend twice as much time with a high-risk kid, and you say to me, well, where the hell am I going to get that time? I'm going to say to you, don't spend as much time with these other kids, or figure out a way, the department needs to figure out a way to handle that. All right? Because you're going to say to me, I can't do that, and I'm going to say to you that you're not going to get the affection.
And it's hard to get over the fact that you want to have to feel good about yourself because you're studying all those good kids.
Exactly, they're easy to feel good about them, yeah, no, that's right. But the other thing we do is we teach a structure. One of the things we've seen in the data, I'm going to talk about it at the afternoon session, I don't want to give too much away, but one of the things we found was the more things you talk about, the less effective you are. You got to focus on one thing and work on that. And we actually have a process we train them. So it's really giving you a model for working with a kid, not just POs, case managers it would work as well with, but really giving you a model. But I know that you can't do it with everybody, and I'm saying that you don't need to do it with everybody. You need to do it with the higher end kids. But right now, I'd say that in the last study we did on hours, average was about 240 hours. So again, we're shooting for the 200 mark. If the kid's going to school, if the kid's, they got a part-time job, I mean, doing those things, I would say you probably that dosage won't quite be there. But I think you have to look at, as I said, you can't have a program. If you send a kid to a program, you need to ask them, how do they vary the intensity for high-risk kids? I can almost assure you what they do now, they don't. They get the same groups, the same time. And what do they say? We do individualized treatment. Right. Well, his question is, if you do 100 or 200, what time frame? Here's the challenge with it is, you can't, these are kids. You can't give them 8 hours a day and expect them to learn because it's a skill base. So I would follow the same scripture we use, I'd say 3 to 9 months during that period of time. All right? Less than that, you can't do it unless they're in a real structured environment. And more than that time, expect that kid to start to drop off the cliff. So I would work it within that period. But let's say this too, it's not only the PO meeting with them, right? It's the groups, it's the other stuff they're doing, and so forth.
I hear you saying that you're going to do that.
I'm going to talk a little bit about it to the managers, yeah.
Okay, so is that something that's actually happening already?
We're testing it in 5 sites right now. We're doing controlled studies. And what we do is we train officers on it and their supervisors. And then we have a group that are not trained. And then they pick the clients. And then they have to audio record their sessions and Gmail them to us. And then we code them. And then we do video follow-ups with them to get their skills up. So we're going to have some data out of our Indiana site in another month or so. The Canadians have been doing it. They have seen, right now they're seeing about a 12% reduction in, or increase in compliance, and they're seeing about a 20% reduction in recidivism, where they've been doing it. But those are the Canadians. They only have like 10 offenders in the whole country. So, we got hundreds and hundreds. So, but we are doing some study sites right now. We got a grant from Ohio to do it. Yes, sir.
It's hard to sell to judges, police, community, parents, and stuff that we should be doing less work with low-risk offenders. Mm-hmm. Is there a large body of research, obviously, that supports that, and that you work in communities to try to bring that around? Less resources and less time has to be spent on that population versus the high risk.
Yeah, there's a large body of research on the risk principle that I could be happy to send to you. But what I say is this, too. Remember, we're not saying don't do anything with low-risk kids. I mean, they got in trouble. They got to be held accountable. You can go from being low-risk to moderate risk to high risk, right? So I would design programming like restorative justice kind of programming. Things that where the kid's going to go in, he's going to do it, he's going to be done, and he's gone. Now, if he keeps coming back, he's probably not low risk. Right? I mean, that's an assessment. You start assessing him and see what's going on in his life, right? And remember, even some low-risk kids are going to fail, right? But I think you have to sell it as, look, first of all,